Hello, I'm Susan Weinstein, Co-Executive Director at Families for Depression Awareness. Welcome to our Coping with Stress and Depression webinar. We appreciate you spending your precious time with us to learn about how you might be able to better manage your stress in yourself and your family, and to know when and how to seek professional help. We expect that this webinar will last approximately an hour, a little more, including questions and answers. Speaking of questions, please submit them throughout the program. I did review your registration forms to see what you want to learn from this webinar, so thank you for putting your requests in there. I noted that there were many questions about how to help your family manage stress and emotional health, and how to be supportive to someone struggling with stress or depression. I'm confident that we'll be covering topics of interest to you, but also feel free to submit a question through the program as well. Here's a caution. If you are only interested in depression treatment or teen depression, or the cognitive symptoms of depression, or adult bipolar disorder, then this isn't the right webinar for you. We're going to be talking about adult stress, anxiety, and depression, but we have webinars on our website that should serve you well. People always ask us for the handouts, so as you look at the screen, you should be able to click to download a handout of the slides where it says materials. The materials link will also be available in the program description. After the webinar, we ask that you please take another couple of minutes to give your feedback on our online survey. You'll help us improve our program, and we'll thank you by sending you a free copy of our Coping with Stress brochure. You should arrive at the survey page after the webinar, but the link is also available on the Educational Webinars page of our website. For those of you watching in a group, we'd love to hear from each of you, so fill out a survey and we'll gladly send you each the brochure. If you find that this webinar is helpful to you, please forward the link to your friends and colleagues. The recorded webinar will be available for viewing on our website, www.familyaware.org. Actually, if you don't do the W's, that's fine too. Finally, we hope you'll help us reach more people by making a tax-deductible contribution to Families for Depression Awareness. So tonight, we have a very ambitious agenda. We'll be talking about stress and its impacts. We'll be talking about family stress, both for civilians and military families. We have many ways about strategies for managing your stress. We also talk about anxiety and depression. We'll talk about getting help. And one of the things that's really important to Families for Depression Awareness as an organization is making sure that caregivers are aware of the demands that are being made of them and how they can take care of themselves so that they in turn can take care of others. Then I'll hop back in and I'll talk a little bit about Families for Depression Awareness. Then we'll have questions and answers, and then we'll say goodnight. I'm very happy to be able to welcome our presenter for this evening. Dr. Liza Zwiebach is Associate Clinical Director of the Emory Healthcare Veterans Program and an Assistant Professor in the Department of Psychiatry and Behavioral Sciences at Emory University School of Medicine. Dr. Zwiebach is a practicing psychologist, and she works predominantly with returning veterans, specifically for treatment of post-traumatic stress disorder. She's also a trainer with the STAR Behavioral Health Provider Program, which provides instruction to community clinicians for working with military service members, veterans, and their families. We do like for them to be competent in the care that they are giving. Dr. Zwiebach earned her PhD at the University of Massachusetts in Boston, where she first discovered her passion for working with veterans, and she completed her internship at Bellevue Hospital Center at New York University. Dr. Zwiebach, thank you for being here, and I'll turn the program over to you.
Thanks very much, Susan, and thanks to all of you who are spending your Tuesday evening with us. I'm really excited to present all of this material. So let's get started. So what we wanted to do first was just kind of lay out some definitions. Terms like stress, anxiety, depression are thrown around a lot. And what I want to do is just kind of really clearly delineate what it is that we're talking about when we use terms like that. So when we're talking about stress, stress is just the body's way of responding to any kind of demand that's placed on us. and that's the kind of demand that can happen on a daily basis. Stress is the body's response to any change, large or small, any change from the status quo. So even positive changes will provoke a stress response. And when we think about not so much the day-to-day, but, kind of bigger life events, even the positive ones, those still add stress to our lives. So, for example, moving to a new home or the addition of a new family member, a new baby, will certainly add stress to our lives as there's kind of a disruption to the baseline system, and the body has to readjust to that change. So in a short term, when we respond to a stressor, that's an adaptive response. That's the body's way of surviving and of negotiating changes, just the vicissitudes, the ups and downs of the day and of life. So that's the definition of stress. Now, when we're talking about stress on the family, it's really the same idea, or it's a similar idea, that just as there can be stress on the individual and on the human body, there can be stress on the family as a unit. So the kinds of things that might happen within a family unit, any of the things that are listed in this slide, will cause some demands on the family unit, a change, and the unit will have to kind of negotiate that change, that disruption, as it kind of finds its new normal. So, for example, the kinds of things that are associated with child rearing or with moving homes, the kind of things, the kind of disruptions that occur when there's an illness in a family member, or when there are financial stressors or strains that are placed on the family. Family of origin relationships. So I'm sure nobody listening has any issues with, for example, in-laws. So joke, certainly. But really any kind of demand, again, that you can think of that could be placed in a family unit is going to cause some degree of stress on the family. And again, that could be positive events, that could be negative events. Now, as Susan mentioned, I work predominantly with veterans, and so I tend to have a little bit of a veteran lens whenever I'm thinking about really any of what we're talking about tonight, stress, anxiety, depression. I tend to kind of gravitate in my understanding towards the types of populations that I work most frequently with. So when we're thinking about military families, we're thinking about sort of particular stressors that population might face. And so, for example, military families have to move around a lot. Military families often face kind of a lack of control over where they might live. And certainly when there's the case of a deployment of a military service member, there can be the absence of that person from the family for a period of time. There's also, of course, many additional stressors associated with having a family member deployed that are related to concern for that person's safety. Also for the parent who remains back at home, the non-deployed parent or spouse, there is managing the family basically as a single parent for some period of time. So you can imagine that also would cause quite a bit of stress on that parent and on that family for a period of time. In general, there is a lot of adjustment that is particular to being part of a military family. Now, the way that I think about it is that resilience in general, resilience in individuals, resilience in families, resilience is the rule. It's not the exception. And so most families are able to weather the stressors that life will present. They're able to kind of adjust and readjust, and that's true for military families as well. With the right resources, with support, and with good communication, good self-care, the stressful situations that we're talking about are able to be managed. So what I want to talk about specifically now is acute stress. So not so much the day-to-day demands that we have to face in our body's stress response to those, but more what happens during an event where we feel a really acute rush of kind of the fight or flight response. So thinking about it like this, what happens to your body when you slam on the brakes to avoid hitting a dog? I hope nobody has been in that situation before. But if you have, you probably remember what it felt like. You probably remember what your reactions were. So maybe you felt your pulse racing. Maybe you felt tension throughout your body. Maybe you noticed your breathing change. You know, it's like your whole body and your whole brain was sort of gripped by this rush of fear at the situation that you were in. And then when you didn't hit the dog and when the dog moved out of danger, your body maybe let go of all that tension. So the thing is, maybe you haven't been in that particular situation, but odds are you have been in a situation where you did feel that kind of fight or flight response. We'll talk more when I say fight or flight. We'll talk more about that in a bit. But for now, I just want to focus on what that actually feels like. And we all experience that in our own unique way. Maybe some people feel more of like a GI response. Maybe some people feel more of like a rush of blood to the head, maybe some dizziness, things like that. So we might all respond uniquely, but we will all feel kind of this flood physically of fear-related sensations. So most of us probably know, most of us can probably tell when we are feeling the effects of stress. As I mentioned in the last slide, we all might have, kind of particular variations of, some or any of these items on the list. Some people might tend to feel the effects of stress more in their gut. Some people might notice other effects that they experience. For example, they might notice muscle aches or tension. Some people might notice that stress kind of expresses itself with other kinds of somatic responses, like skin problems, or maybe a somewhat more compromised immune system. People might get, colds, flu a little more frequently. Their body is not as able to kind of fight off the normal kinds of, the normal kinds of little illnesses that go around. Other times, people might notice more of an emotional response to stress, so they can snap more easily. They find that the stress seems to express itself in a quicker temper or in a lot of worry, or possibly, they're not feeling as sharp as they typically do. They have problems concentrating or remembering things. When I am under a lot of stress, I find I lose things a lot. I find I leave my keys in places where they don't belong, and then I have to spend time kind of finding them, and that's when I know I need to kind of slow down and maybe engage in a little more self-care, which, again, we're going to talk much more about. So I mentioned before the fight or flight response, and actually I misspoke because it's really the fight, flight, or freeze response. Now this is an adaptive mechanism that is hardwired into us as human beings, as animals. It's there to save us. It's there to help us survive in conditions of extreme threat. Basically, the body under those conditions has those three options: to fight, to flee, or to freeze. Now, the freezing actually is kind of like an animal playing dead. But these are, again, these are kind of the body's emergency response. Now, like I said, it's meant for conditions of grave threat. When the body is in fight, flight, or freeze mode, a flood of hormones, adrenaline, cortisol, other body chemicals are released into the system. This is all meant to prepare the body to, again, fight, flee, or freeze. We're not actually meant to spend too much of our lives in the fight or flight response, or freeze response, excuse me. We're meant to kind of have it when we need it and not be experiencing it when we don't need it. Now, so it's a short-term reaction. It's a short-term measure. When braking for a dog in the road, that bodily response is helpful. It helps us spring into gear because we need to do something, right? There's an emergency that's about to happen, and we need to be prepared to attend to that emergency. Now, where sometimes people get themselves into some trouble is when the level of stress in their lives is longer term, or when it's unrelenting. So if you're under kind of constant and consistent stress, you might experience the fight or flight or freeze response more than really we are designed to. And so we can have our bodies kind of be overwhelmed with these hormones, these sort of stress hormones that are only meant to be there in the short term when we most need them. And long term, those chemicals can have harmful effects on our bodies and on our brains. So in terms of that, in terms of the stress, in terms of the damage that chronic stress can affect on us, we can have sleep problems. We can have anxiety. We can, as I mentioned before, notice that our immune system is a bit compromised. As Western medicine sort of advances, there seems to be, I think, a much greater acceptance of the idea that the mind and the body are really inextricably linked. There's sort of an old school mentality that separated those out. And in more recent generations, it's become much more understood that, the kind of stress that we were always aware of on a more emotional level or in our minds really has an effect on almost every physiological system we have and we need. So, for example, things like infertility, things like problems with diabetes, weight gain, heart conditions. There's ample evidence at this point that all of those conditions are exacerbated by lots of stress. And there is a note on this slide. If you have a moment, it's kind of an interesting exercise to take the Holmes and Ray stress test. It's a list of stressful life events that can contribute to, overall lessened well-being, possibly illness. So again, if you have a moment later on, you might find it interesting to take that test. Now, in terms of stress on the family, you know, I kind of indicated before that as goes the individual, often so goes the family. So when there's a lot of stress in a family, some similar or analogous things may be happening. So there may be more, for example, irritability between or among family members. There may be more somatic issues. When I say somatic, I'm talking about things like headaches, stomach aches, kind of non-specific illnesses. We see these often in kids. You know, we see, for example, kids with like fevers, upper respiratory infections. Those might be an expression of stress. We might also see reduced ability to take care of the home. And we might see some avoidance. So, for example, an avoidance of the family spending time together, or avoidance of family members socializing with others. There's a little bit of maybe a shutting down of the normal routines and functions that you would see in the family under conditions of increased stress. So we all have our ways of coping with stress. There are healthy ways, there are unhealthy ways, there's a whole range. Sometimes, as indicated in this photograph, people might let their diet go a little bit. You know, eat too much sugar or fat. Or they might go the other way and restrict. Sometimes people respond to stress by just not being able to eat at all, not having an appetite. Other times, people might engage in other kinds of behaviors, which, you know, we might think of as problem behaviors as a response to stress, as a way of self-soothing, I might think. So, for example, spending a lot of money, or using drugs or alcohol, which we'll get to also a little more later on. And there are healthier ways to cope as well. Again, there's a whole range. So sometimes people find that exercise is a great coping strategy. I might say I think probably every one of us could do a little bit better in terms of our particular range of coping strategies. So some of us maybe are better than others in general, but I think we could all use a little help. We could all use maybe a few more healthier adaptive coping strategies to add to our tool belt. So, and on that note, certain things are pretty well demonstrated. So, relaxation time, kind of focused, directed, protected time to relax, is something that probably not a lot of us make a commitment to in our lives. And yet, it really pays off immeasurably. So certain things in this list are no-brainers, right? So most of us know that, for example, exercise is great, too much coffee, too much alcohol, probably not so great. I think we all probably understand those intuitively. And yet, it can be pretty hard sometimes for any of us to commit to a healthy lifestyle, and in particular, to commit to coping with stress in ways that in the long term are healthy for us and don't just feel, soothing to us in the moment. So, like eating a balanced diet, great for us in the long term. Exercise, fabulous. Committing to having enough time to sleep and engaging maybe in healthy sleep habits in order to increase the likelihood that you'll get good sleep. Setting limits, that's a particular downfall of mine. I tend to say yes to a lot of things and then wonder why I put myself in that position. And it can be really hard, actually, to change that habit. I wonder if all of you can spend a moment thinking about what strategies you use to cope with stress. And in particular, maybe think about what your best coping strategy is. You know, in other words, what your healthiest coping strategy is. Now, one thing that also tends to maybe go unnoticed or not get talked about as a coping resource or a coping strategy is to practice gratitude or gratefulness on a daily basis. Making a conscious choice, actually, to feel and to express that gratitude. And sometimes all we need to do is find gratitude in really, really small things. But really the key is to pay attention to those things and appreciate them. And maybe write it down. Or maybe say it to someone. So for example, if somebody in your life is somebody that you're grateful for, or they do something on a particular day that you're grateful for, can't hurt to share that, can't hurt to tell them. So that's also the kind of thing that takes a little bit of commitment, right, to kind of make sure that this is something that you're choosing to do on a daily basis. And yet, it's really, really helpful. It really, really pays off to do something like practice gratefulness, even just for like a minute each day. Another good coping strategy is what's called reframing, or taking your negative thoughts and shifting them a little bit. So certain kinds of, I might say, mind traps, we're all vulnerable to. We're all vulnerable to distorted thinking, or blowing things out of proportion, or a word that mental health providers like myself love is catastrophizing. Really kind of taking the negative aspects of a situation and overly focusing on those, making it the end of the world. Again, we're all susceptible to doing that at any given time. The key is to know that you're doing it, recognize it when a thought that's sort of maybe catastrophizing or blowing the negative out of proportion, recognizing that thought when you have it, and reframing. So for example, if you're late to work one day and you think to yourself, I'm always late for work, when that's, most likely not true, you might need to spend a moment kind of talking yourself out of that negative thought and just looking at the evidence kind of against that thought, rather than stay stuck in that thought and all of its negativity. Often it's negative thinking, the catastrophizing, the negative interpretations that can drive us a little further into an anxious or a depressed mood. And another type of reframing, finding the good within you. So that can really help to lift your mood a bit, taking the time to focus on your own attributes that you appreciate. So, again, maybe take a moment, look at yourself, and think of one thing about yourself that you really like, that you think is a really, really nice characteristic that you possess. So I want to talk a bit about an additional type of coping strategy, and that's mindfulness-based stress reduction. Now, probably many of you have already heard of mindfulness, at least heard of it, if not have learned quite a bit about it. It's sort of, it's become sort of all the rage, right? It's on the cover of Time magazine, things like that. But it's actually been around now for many decades and has been demonstrated to be really beneficial in terms of negotiating everyday stressors, as well as in terms of being part of certain treatments for anxiety and for depression. And what mindfulness is, it is experiencing your life, and in particular, experiencing a moment of your life in a way that is purposeful, that's without judgment. It's where you're focused not so much on the future or on the past, which is kind of how a lot of us tend to go about our days and our lives, you know, thinking about what happened yesterday, thinking about what we have to do tomorrow. Mindfulness is a choice to instead just focus on what's happening right then, on what's happening in our bodies and on what's happening in our environment right around us. It's a time when we can just focus maybe on our senses and the information that our senses are taking in. There are many ways to practice mindfulness, but what they all have in common is an intent focus on the present moment. So I mentioned there are many ways of practicing mindfulness. These are some. So again, I'm guessing that many of you probably already do some of this. I think probably 100% of the people I know practice yoga, actually. Probably not 100%, but I think close. There are many, many ways to do this. But mindfulness can be as simple and straightforward as just focusing on your breathing for 3 minutes. And that is actually a technique that I practice often with my patients. So I might begin a session by just doing a really quick 3-minute mindfulness exercise with my patient, as you know, my patient and I just kind of sit quietly and attend to breathing in and out. Another really kind of simple everyday way to practice mindfulness is doing the dishes, for example. So instead of doing the dishes while thinking about what you have to do tomorrow, maybe you can do the dishes and slow down and focus just on doing the dishes. So for example, feeling the warmth of the water on your hands, looking at the soap bubbles, noticing what they look like, and hearing the swishing of the water, and focusing on each one of your senses, what you're hearing, feeling, seeing, smelling, and doing that without judgment. So focusing just 100% on what's happening for you right then. Now, again, different things work for different people, but when we're thinking about taking care of ourselves in a mindful way, these are some ideas. So being outside, taking a break, being present in your conversations, these are all kind of nice suggestions that if you're not already doing them, you know, you may want to try them. Now, reducing stress takes commitment. It's very easy for us to react to stress with less healthy coping mechanisms, like the kinds that we've already talked about. And it can actually be quite a bit harder to make a commitment to reducing stress and cope with stress, I should say, in more adaptive ways, to make time to relax and practice mindfulness, you know, to make time to exercise. It's something, again, that I think we could all use more of. And the same strategies are applicable to families. So making time to be together as a family, making time to talk and to communicate openly, making time for, it's corny, making time for family fun, for having a game night. This can take some planning and it can take commitment depending on how busy families are and individual family members are. And yet it's, something that we might all do better and benefit from by doing. And in terms of supporting others, so in terms of how to help somebody who is affected by stress, sometimes all you need to do is let somebody know that you're there and that you're willing to listen, or that you're willing to provide some instrumental support, help them with a project, help them identify a way to cope. In terms of veterans, because I am very veteran-centric, fortunately, there are lots of resources for veterans, and so it can be a really helpful thing if somebody who's a veteran who's struggling just has knowledge of a particular resource, and sometimes maybe that's a helpful thing that you can do for a person. Now, so I want to spend time talking about what happens beyond normative or ordinary levels of stress, and I'm thinking specifically about anxiety and/or depression. So anxiety and depression are medical conditions. They affect people across all strata, so any age, any gender, any race, any income level. Now, the good news is that there is really good treatment available for anxiety and for depression. And not only is there good treatment, but there is a lot of variety in types of treatment. We can talk a little bit about that. Anxiety and depression are also often occurring with a biological basis. So there is some genetic predisposition towards anxiety and or depression, which does not mean, and I want to be really clear about this, does not mean that a person who has a parent who struggles with one or both is consigned to do the same. Now, in terms of anxiety, so anxiety is an excessive feeling of dread, fear. It's future focused. It's focusing on what might happen. And anxiety is a little different from anxiety disorders. So anxiety is part of life. We all, just like stress is part of life, we all experience anxiety at some time in our lives. An anxiety disorder is a little different. So an anxiety disorder, by definition, is a condition that's interfering with function. It's interfering with daily life. It's causing distress. Some kinds of things that might indicate the presence of an anxiety disorder are panic attacks or really extreme avoidance. A person just stops doing the things that they once did. They withdraw. Or it might look like repetitive behaviors. The idea is that this is something really beyond what I would consider, and I think maybe what we would all consider a normative level of anxiety, which, we're all prone to. Anxiety disorders are extremely common. So, more than 40 million adults in the U.S., according to a large epidemiological study. Signs of anxiety disorders, some of them are listed here. So, again, what you're looking for is really what goes beyond the norm, right? So we're all probably pretty familiar with anxiety, for example, when we have to take a test or give a presentation. and we might be able to kind of anticipate how we would feel in that situation. But an anxiety disorder is going to be way beyond that. It's going to maybe seem irrational or excessive, or again, interfere with daily life or functioning. Or maybe it's causing other problems, like, for example, headaches or GI distress, insomnia. These are just some of the things that you might see with an anxiety disorder. Now, depression, also a medical condition, and kind of an analog, right? So the thing is, we are all, just like anxiety is part of life, sadness is part of life. We're all going to experience sadness at some point or other. Clinical depression, though, is something different. It's interfering with functioning. It's interfering with daily life. It's beyond the normative levels of sadness that you might expect someone to feel based on sad life events. However, depression, just like anxiety, is highly treatable, and that if you take nothing else from tonight, that is something that I would want people to take away. Just like anxiety disorders, lots of people have clinical depression. Now, the kind of signs of depression that you would be looking for are sort of a persistence, right? So sometimes we have low moods for a day or two, but depression is going to be more persistent than that. It has to be around for at least 2 weeks. Sometimes it's around for way longer than that, unfortunately. But when we're talking about depression at a clinical level, it has to be around for at least 2 weeks. A markedly low mood, or I should say, losing interest or pleasure in most activities. Now, if you or if someone that you know is having thoughts of hurting themselves, having thoughts of suicide, don't pass go, don't collect $200, seek help. And really, the thing to do is go to the emergency room or take the person to the emergency room. Can't stress that enough. If somebody is in my office and is expressing suicidal ideation, I take that very seriously, and I'll immediately begin talking to them about going to the hospital. So that's a critical point, that if that is what you're noticing in yourself, or if that's what you're hearing from somebody else, that's urgent. But beyond that, additional signs of depression, you might see changes in sleep patterns or eating habits, just things that are really just core, just central to functioning. You might see disruption in that. You might see other changes in health, so non-specific aches and pains. You might see maladaptive coping, so abuse of alcohol or drugs, for example. Everybody's going to look a little different, but these are just some of the things that you might see. And in terms of what others could notice about a person who's depressed, they might notice a lot of negativity in what they're saying, a lot of hopelessness in what they're expressing. You might notice irritability, actually. Irritability can be a sign of depression, in addition to kind of just a sadness and depressed mood that we would immediately think of. You might see a lot of withdrawal from people. Often when somebody is depressed, they really don't want to see anybody. They don't want to hang out or engage in social activities. You're looking for a deviation from the norm that will look profoundly negative. Now, in terms of veterans, so, at this point, the veterans have become sort of inextricably linked, I think, in the popular imagination with PTSD. And veterans do have a higher likelihood of experiencing post-traumatic stress disorder or PTSD than the general population. However, there are many other kinds of conditions besides or in addition to PTSD that veterans and service members and their families are also susceptible to. So anxiety, depression, many other mental health conditions. In the interest of time, I don't want to spend time on statistics, but I just want to be clear that if anybody is interested in statistics, I'll be happy to share those or make sure that those are made available. Now, in terms of getting help, not to beat a dead horse, but if you or if anybody that you know is expressing suicidality, you need to act, right? So if it's somebody else, don't leave the person alone. Talk to them about calling 911 or going to the hospital. If it is yourself, take yourself to the hospital or call 911 or call, as listed here, the National Suicide Prevention Lifeline, but reach out. So if that's what's going on, that's what you need to do. Now, if you're curious about your own level of functioning with regard to mental health, online screening may be something for you to do. So listed here are some ways to do that. And in terms of where to go for help, so if you or someone that you know is feeling overwhelmed by stress or seems anxious or depressed, there are lots of options. So, your insurance company is a good resource. Your primary care provider is a good resource. If you are already engaged with a mental health clinician, that's a great start. And if you have an employee assistance program at work or with your employer, that is also a good start. Any or all of these are good ways to go. And there are specific resources for active service members, active duty service members, that is, and veterans. And they're listed here. And this is not an exhaustive list, by the way. And if anybody is interested in additional resources, I can also make those available. But these are just a few. Now, in terms of what the treatment options are for depression, it's two broad camps, right? So one is psychotherapy, or what's often referred to as talk therapy, and medication. And these tend to be, when combined, these tend to have the greatest effect. So each one of those can be pretty effective on its own, but if you can receive both concurrently, that's your best bet. Now, specific kinds of psychotherapy are really well demonstrated to help with depression, and by specifically I mean cognitive behavioral therapy, or CBT. So there's a huge body of research demonstrating the effectiveness of CBT for depression. Now, medication as well has some pretty good, at least certain medications have some pretty good efficacy data, and they can really sort of help people out of, what feels like the hole of depression. Sometimes it can take some trial and error for a person to get the right medication or the right combination of meds. Now, in terms of being a caregiver and what kinds of things the caregiver needs. I want to spend a little time on that. So being a caregiver for anybody is incredibly stressful and can really seem to kind of suck up all of your time and resources. And it can feel, when you're in that position, like you really don't have time to take care of yourself. You really don't have time to devote to committing to self-care. However, and again, this may sound like a bit of a no-brainer, you don't really have time not to do that. Because if for no other reason, if you are not taking care of yourself, you won't really be able to be much of an effective caregiver. So we all sort of have a limited amount that we can give to others at any given time, and we need to replenish that amount with our own self-care. So particular self-care strategies, and these many of them harken back to what we were talking about earlier in this presentation. The same kinds of things that help us navigate and negotiate kind of everyday stressors or bigger stressors, those are the same kinds of things that I would recommend in terms of self-care for a caregiver. So being careful to set limits, set boundaries with others. Making sure that basic needs are taken care of, making sure that you're eating right and that you are giving yourself time to get good and regular sleep, and taking a break when you need it, and, looking to others for support, so making sure you have good friends, making time for mindfulness. This can be like, again, this can be like 3 minutes out of your day. In general, what's good for self-care, for anybody is good for self-care for the caregiver. And these are really just, I would say, kind of a universal list of things that are beneficial. Eating right, sleeping well, taking time for relaxation, taking time to enjoy, a laugh with friends. These are good for everyone. Okay, and so I think, oh yes, Susan, go ahead.
Well, thank you. I hope that you're doing this webinar was not an example of you committing to too much, because I think you covered a whole lot of ground and gave some really valuable information, so thank you. I'm just going to take a couple of minutes to talk about Families for Depression Awareness, and then we'll get to your questions and answers. And just to remind you that we do ask that you take the survey afterward, and we'll send you that Coping with Stress brochure. So Families for Depression Awareness, we help families recognize and cope with depression and bipolar disorder because we want people to get well, and we want to prevent suicides. We are a national organization based in Massachusetts. Our website has a wealth of information. We have many, many different kinds of resources, educational materials, so please go on there and explore, and I would also say use the little search function. One of the things that distinguishes Families for Depression Awareness from others is not just our focus on family caregivers, but also the fact that we were one of the first organizations to bring real people with real stories to the forefront in an effort to educate others, make them feel that they're not alone, and also to give inspiration. So you'll find family stories. You'll also find interviews with experts. So there's a whole lot there. One of the things that we really try to do in terms of reaching well beyond Massachusetts is that we have a lot of our education not just on our website, but through webinars. As you can see, we have several different webinars at this point. You'll be able to go and send other people to the Coping with Stress and Depression that we're just doing now. We recently had our teen depression program with a clinician, but also a mother and daughter who shared their own experiences, and that was a great listen, so I would recommend that. We also have treatment. We have a program on adult bipolar disorder, and we also have a program on more than mood. we undertook a couple of years ago to start explaining to people more about not just the sadness kinds of indicators of depression, but also just that there are real things that happen to your brain that make it hard for you to function. And we came up with this acronym to describe the ROAM symptoms of depression because they affect reasoning, organization, attention, and memory. We built a whole toolkit about this, so please just go visit on our website, and it is the More Than Mood page. We have certain tools that you can use. You already heard the reference to our screening test. We also have a wellness analyzer so you can track how you're doing. And for bipolar disorder, we have a mental health family tree that helps to show your clinician that certain people in your broader family and generations previous might have had certain behaviors that could be indicators of bipolar disorder. We have workshops so that if, for example, you thought that this program would be great at your office, but you live in Iowa and my staff can't come out there to do it, we sell a workshop so that you can learn to be a facilitator of this program. You don't have to be a mental health clinician for the Coping with Stress program, so if that's something you're interested in, get in touch with us. I would like to highlight the second brochure from the far right is our brand new adult bipolar disorder brochure. We're thrilled with it. We've gotten tremendous feedback, so I encourage you to check that out as well. We also have wellness guides, one for adult depression, and then in both English and Spanish, we have the sets for teens and parents for depression and bipolar disorder. Our teen depression program has a webinar and a workshop, the workshop for people in Massachusetts, or if you want to offer it in your own town. We have teen speakers that we have young adults and teens who have their own lived experience. We work with them to craft their story. We work on their presentation skills, and then we take them out and they go to schools, they go to youth groups, and they talk about their own experiences because we're really trying to reduce stigma and encourage help seeking. So for people who do not live here, we are making more opportunities to participate in Families for Depression Awareness events, primarily online. We've just launched our teen Instagram account, Family Aware Teens, and that is working on becoming a community of people in their teens and young adulthood to share with each other, be supportive, and learn more about living with mood disorders. You know, and also just to take away some of that feeling of being alone. The thing that I spend a lot of my time on is our Care for Your Mind advocacy blog. We bring people who are experts in fields of mood disorders and advocacy and research and people with lived experience, and we look at what we can do with our mental health care system to make it work for us. There are all kinds of things that people are trying, that government is creating policies around, and they really need to hear from the people like us who are affected by these rules that they make. So I would invite you to visit careforyourmind.org. We're just talking about teen stress this week and next week as well. So please join us there. And finally, my great thanks to Dr. Zwiebach for being with us and doing this program today. We are also grateful to our funders. We receive funding from the Commonwealth of Massachusetts Department of Public Health through their suicide prevention program, and we receive funds from the Allergan Foundation, so we are grateful to them. Also, as I mentioned at the beginning of the program, people just like you who are watching webinars find that we have offered something of value to them. And so they want to give back. They want to share stories with us. They also want to support us financially. So if you are able to do that, we very much appreciate it. Let's get to some questions and answers. Just starting off, Dr. Zwiebach, what do you think of the effectiveness of support groups, and are there good ways to structure them?
That is a great question. Well, so support groups, if I'm understanding correctly that the questioner's notion of support groups, there is not a lot of demonstrated efficacy associated with support groups. In other words, it's not a treatment, right? It's not a treatment for depression or for anxiety. However, having social support is always better than not having social support, and particularly if you're a caregiver, having a caregiver support group. I don't know that there's research on this, but I would think intuitively that it's a great help in terms of navigating the stressors of that role.
Wonderful. So when we talk about anxiety and stress and depression, we've listed a whole lot of symptoms. And for example, on the anxiety, you can have GI problems, you can have headaches, there's a whole lot of things. But I think what we're looking for is if someone has a lot of those symptoms, does that mean that they have depression? Does that mean that they have anxiety?
Also a great question. I would say, so psychiatric diagnosis is a funny thing because there's no blood test. There's no objective test, really, for anything, right? So if someone comes into my office and complains of a lot of those types of things, I may kind of make a judgment call depending on what the diagnostic criteria is. The diagnostic criteria of either depression or an anxiety disorder will be, a long list of those types of symptoms, and I'll just make a determination based on what the person is endorsing, how many of the symptoms they're endorsing. I would not say that if you were, if a person who's not a diagnostician, not a mental health provider, if you're observing this in somebody that you know or that you're close to, I wouldn't go around necessarily diagnosing that person or saying with certainty that they have depression or anxiety or what have you. But I think if you're observing a lot of things that are just, kind of objectively disturbing, I might encourage that person to go see somebody who can arrive at a diagnosis.
And I think the other piece is, to what extent are those affecting your functioning? Because that's one of the real hallmarks, is to assess these and see to what extent they are disrupting your life.
Correct.
Thank you. Is there a difference between the way depression is treated and the way anxiety is treated?
Yes. So in terms of psychotherapy, there tend to be different interventions for depression versus anxiety. Sometimes there might be some common factors. So, for example, I talked before about catastrophic or catastrophizing thoughts, and that's the kind of thing that you would see a lot in either depression or anxiety, and so psychotherapy might target, that in either case. However, the core treatment's going to look a little different. In terms of medication, which is a little bit outside of my scope because I'm a psychologist, I'm not a medical doctor, I don't prescribe, but the types of first-line medication treatments for depression and anxiety have a lot of overlap. So in other words, there can be sometimes subtle differences in the ways that anxiety versus depression is treated.
Great. I know that we talk about taking care of yourself a priority, and it's really easy to say and not so easy to do. So if you have a loved one who's really struggling, what kind of self-talk can you do, or how can you make it that you don't feel guilty about taking time?
About taking time for oneself. Yeah. I mean, I'm not going to say it's easy, right? But I think that, I think really just remembering the idea that we all have finite resources to give, And we can really run those resources down very easily if we're not taking care of ourselves. And so we're ineffective, you know? I mean, I think if one is prone to feeling guilt around taking care of themselves, then I think maybe an easy way around that is to remind that person that they won't be much help to anybody if they're not first doing that. But again, it's hard. It takes commitment.
Mm-hmm.
And the other thing that I would say is a little bit is better than nothing, you know? So sometimes it's not possible to take like an hour for yourself, but maybe you can take 5 minutes.
Make the best of the time that you can have without. And I mean, I think you probably also could use the reframing that, I think that's essentially what you're saying. You can't be of help to others if you're not helping yourself. So rather than feeling guilty, reframe it as I'm doing what needs to be done so that I can be there for the people I love.
Mm-hmm. Yeah, well said.
Well, thank you. So say you work in a particular environment. Stress is, to some extent, a reaction to your environment. What if you're working with people who are hostile or negative or just not particularly friendly or accommodating? How can a person manage that, stand up against that, you know, keep their own well-being despite continual negative influences?
Yeah, also a great question. Well, I'll tell you kind of the way that I see it. So sometimes I have somebody in my office and what they really want to change is somebody else. And I can't do anything about that. And moreover, my patient really can't do anything about that. And so, again, this can be easier said than done, but there's a lot in life that we don't have control over. And it's really unfortunate for a person who is in a work environment with people who are really hostile. And also not within really anyone's control to change, right? So we can't change other people. And so that's where I might recommend and might try to work with somebody on what I might call radical acceptance. And I can talk a little more about that if that's helpful.
Why don't you go ahead? Why don't you explain that?
Yeah. So the way that I would think about it is, you know, we can kind of take it as a premise that this person outside of ourselves we're not going to be able to change them, and our reality is what it is, and that's unfortunate. And also, it doesn't leave us with a whole lot of options to sort of stay miserable about this person who causes us distress. And so we may just have to accept and really commit again to accepting that our reality just is what it is. And acceptance is kind of interesting. I could talk much more about this, but I don't want to spend too much time on it. But it's of particular interest to me. Just kind of making a commitment to not struggle with suffering around things that can't be changed and can't be controlled.
And I would venture to say that you also probably need to make sure that you're not, I'm not a clinician, so I can't say it, catastrophizing, that you want to make sure that you are in a reality, that you are not overreacting to things. And imagining things as worse than they are. But I'm certainly not one to discount how someone feels about it, but it may be that that's not exactly the thing that is as bad as they think it is. But this also leads into something else. We've gotten several questions about helping someone who really isn't in a place where they want help. They either feel too bad to think that they're not worth getting help, or they feel like it's your problem, not my problem. There are several reasons why people refuse help. I mean, it's also scary. It's scary to say, I'm suffering from depression and I need help.
Yes.
So, there again, you're in a position where it's someone else's behavior that you can't change. But how, as a caring friend, spouse, parent, adult child, how can you work with that and get the person to where they can get care?
Yeah. Well, I think it's very hard. And, what I would say is that, excuse me, I'm sorry, just struggling with some allergies. What I would say is that, I think people are more likely to dig in their heels when they feel like they're being nagged to do anything. And so I think in a situation like that, I think the best route is to just be a compassionate friend / family member / spouse, whatever your role is. And again, I'm not saying that's easy, but I think that I think, to use kind of a trope, I suppose, people really need to be ready to change in order to actually change. And by change, really, I don't mean anything more grand than just coming forward and seeking help, but I think any kind of change people really need to get to a readiness to do. And if unfortunately, a person is sort of in this role where somebody they care about just isn't there, I think the only thing that you can do, I think I should say the best thing that you can do is just join with them and just be with them in that moment. Unless things are rising to the level of emergency, as we've already talked about. But short of that, I think compassion is the main thing.
I support that, and also I would recommend that people go to the Family Aware website and look through there a little bit. So let's make this the last question, sadly, but for people who are looking at the whole family, as we've been trying to do tonight, parents do a lot to bring good nutrition into the family and the way the household works, and they work to model exercise and other fitness activities, and they try to do good communication skills, things like that. How can they make emotional wellness part of that way of functioning?
Yeah. I think the kinds of things that we talked about, early on in this presentation, so committing to making time for shared family activity and the commitment to open communication. I mean, these sound a little obvious, I think, but also can kind of fall by the wayside sometimes when people and when families have really busy lives. I think it can take some organization and planning, just like focusing on nutrition can. But I think it's a really beneficial thing to just sort of, whether it takes formal scheduling in a calendar, but just family dinners where everybody's together, for example, making a commitment to that shared family time, family goals and pursuits. I think that's a really, really valuable idea.
Yeah, and I also think that you can do those kinds of things, but you can also, sometimes make it a gratitude dinner, that you all are at the table and you want to say something that you appreciate about someone who's sitting at the table with you. I mean, I think that feels good both for the person giving the feedback and the person receiving it. So I think that people can get creative about sort of mixing and matching the various things. And sometimes, when we show that slide that talks about, strategies for managing stress, some of them are so obvious. They're like right in front of us. But it takes a reminder, and it takes sometimes a little nudge to get into doing that. So we're going to wrap up now. Dr. Zwiebach, I can't thank you enough for all the great insights you offered and the good information that you shared. Thank you so much for your time and energy on this. I also want to, Well, my pleasure. I want to ask that people, again, take the survey. We would love to hear from you. Give us your feedback. We always want to improve our programs. We want to make sure we're giving people what it is they're looking for, as long as it's within our scope. And if you are inclined to take the depression test, go to the website, and the website will also offer you a lot of educational resources, opportunities to volunteer, and again, if you're inclined to donate, we would very much appreciate it. And with that, I will wish everyone a good evening, and thank you so much for taking the time to manage your stress with us.
Thank you.